we are going to speak about Inspect SR. And this is like a case study just in order to get some sort of training on this tool. So these are my conflicts of interest. Inspect SR, it's a tool for assessing trustworthiness of randomized controlled trial. This is a tool that has been developed essentially for people doing systematic review and meta-analysis in order to inspect the trials that they want to include in the meta-analysis and to see whether they think they should include the study or not, because they have big concerns about study trustworthiness. So basically, we are going to see and to use this tool today. Inspect SR has 4 main categories of checks. So you have checks about post-publication notices. You have checks about inspecting conduct, governance, and transparency. You have checks about text and figures. And you have checks about inspecting the results in the given study. What is important is that when you are doing a systematic review and meta-analysis, if you reach a judgment of serious concern for one of the categories, for instance, you start by this one, you reach serious concerns, basically you decide not to include the study in the meta-analysis, and you are not enforced to do all the checks as soon as you have reached one serious concern judgment. But today, we will apply all the checks on the given study. So the study we are going to explore today is this study. It's a published study. It's not retracted. It's called Effects of Low-Level Laser Therapy in Autism Spectrum Disorder. This is a study that compares low-level laser therapy with what they call a placebo of low-level laser therapy. So I don't claim that this study is fraudulent. There is some evidence that this study might be beyond repair, and we will see that, but I have no idea why. So the first category of check is inspecting post-publication notices. And for that, we have 3 different checks. Those 3 checks are the following. Does the study have an associated retraction? Does the study have an associated expression of concern or other relevant post-publication notices? Or do other studies by the same research team highlight cause for concern? And for each of these steps, you have to make your own judgment whether it's a yes, no, unclear, or not applicable. And based on those checks, you will make your own judgment on the overall category. So first of all, is it retracted? So we can go on the website where the paper appears, and you see no mention of retraction. You can open the PDF and you don't see that it was retracted, because usually when a paper is retracted, it's written in it, retracted. So it sounds like it's not retracted, but you can go further and you can go on Retraction Watch. I put it here as the address, and you can put the title. You can also use other way to find the study, for instance, by using the DOI, the PMID. So basically, you can check on this database if it is retracted, because the Retraction Watch database tracks all retractions. So it's pretty complete if you want to see. So you can put the title and you can see no retraction was found for this study. So basically, for the first check, it passed the check. The study, it's not associated with a retraction. So now you can move on to the second check. Does the study have an associated expression of concern or other relevant post-publication notices? You can go on the website of the journal again, and you can try to find if there is an associated expression of concern. You can try to find if there is an associated letter raising concern about the study, but actually there are none. So it passes a check at this point. But you can go further and you can try to find other post-publication notices. And in that case, this study has some comments on PubPeer. Okay, actually there is one comment by me and one comment by the author who answered the comments. This is super useful, PubPeer, because PubPeer is a site where post-publication peer review appear and people can comment on the articles. When you go on PubPeer and you have a comment on PubPeer, it doesn't mean necessarily that there is a problem. So you have to assess qualitatively the comment to figure how much problematic this comment is. You can use a plugin for PubPeer so that as soon as you see a paper in your computer, there is this little window that appears. So for instance, this is a capture from PubMed. I have the information that this study has been commented on PubPeer. So then you can click on it and you can go on PubPeer. If you go on PubPeer, you can see that 2 years ago, this study has been commented. And here I put a summary of the comments that were made on PubPeer, so the post-publication comments. Okay, they might be right, they might be wrong, but they are here. So actually you have to make your own judgment. So by reading the comments, but you can also read the response by the author to make your own judgment. Here, there were some comments that there was an unclear study location, an implausible recruitment timeline, problem with English consent forms, while the study seems to have been done in Cuba. We will see this later. There were no adverse event reported, no patient dropouts observed, which is quite unusual in clinical trials because you always expect some kind of dropouts. Some inconsistency between the registry and the paper. Some inconsistencies in the tables, in the values, some implausible homogeneous placebo data, an implausible treatment effect magnitude, so like a big effect that you would not expect in this context. Some inconsistency between this paper and the follow-up paper. Some contradictory severity score change, some inconsistent laser device descriptions, unclear placebo device definition, poorly reproducible intervention method, questionable participant recruitment feasibility, regression to the mean effects were likely absent in the placebo group, and individual patient data were needed. And actually, if you see the answers, you will see that the authors provided the individual patient data, which is another thing to inspect. So we can see that those comments were quite, I would say, relevant, and they are all comments that you can verify in the paper. And then when you verify it, maybe you can make your own judgment that there is a serious issue with the study. So if you are doing your systematic review and meta-analysis, maybe you can already stop here when you look at all those comments and the seriousness of those comments. But we will go further. Do other studies by the research team highlight cause for concerns? So for instance, associated retraction, expression of concern, and relevant post-publication notices. So this is something you can check pretty easily. For instance, you can go on Retraction Watch database, and on the database, here you put the name of the authors. So you can put the name of the first author, and you can find already 3 different retractions. One in Frontiers, another one in Frontiers, one other in Taylor and Francis journals. So we have 2 different editors and 2 different journals, Frontiers in Public Health, Frontiers in Public Health 2, and International Journal of Neuroscience. And when you look at the reason for retraction, you can see that there were concerns about the article, duplication of article, euphemism for duplication, and investigation by journal and publisher. So in this one, you have some sort of issue related with plagiarism. Here you have also issue related with unreliable results and or conclusions. Here you have again plagiarism. So we can see that for those authors, at least the first author, we have already 3 retracted papers Here are the 3 retroacted papers. You can also check if you are not confident in what Retroaction Watch says. You can find again those papers and have a look at those papers. And then you can look also at co-authors. So basically, we had 3 retroacted papers for this one for this co-author, and actually this was a paper in common, and no retroacted paper for those 2 co-authors. You can also try to find if there were some comments on PubPeer on their different papers, and we can see that for the first author, we have 7 results on PubPeer, 4 results, 2 results, 2 results. And here again, having a hit on PubPeer does not mean that there is necessarily a problem. So you will have to go in these comments and have a look at what those comments say about the paper in question, the problems. But still, we can find some common problems within their publications. So I would say that yes, we have. So it's not directly here a red flag because it does not mean that because they necessarily have retroacted paper, this one will be necessarily problematic. But still, it's a yes, but not qualify at the end of the day for your judgment about serious concern. It's more like you have concerns. Yeah. But still, because comment 1.2 and 1.3, you can still reach an overall domain judgment that you can have some kind of, serious concern. It's a little bit more than some concern because of the content of the PubPeer comments. So now we are going to inspect conduct study and governance of the study and also transparency of the study. For that, we have now 5 checks. Are the concerns relating to ethic approval is the first check for that. So you can try to have a look at the paper. And in this paper, it's said that the study received an approval from the Helsinki Committee of the Institute for Neurology and Neurosurgery in Havana, Cuba, and was registered with the FDA. So it's not really with the FDA, but it's rather with clinicaltrials.gov, and you have the number of clinicaltrials.gov. To be honest, it's not super clear what was the registration number at the ethical committee. So you should expect that. You should expect a date. So this is quite, I would say, missing. It's not a red flag, of course, because it can be due to poor reporting, but it can provide you some reason to be a little bit worried about this study. And I think at this stage, it will be nice to, if you have still concern and you want to explore those, to try to reach the ethical committee. And by the way, we have 2, the Helsinki Committee of the Institute for Neurology and Neurosurgery in Havana, Cuba. And we have also the Office of Research Integrity at the Institute of Neurology and Neurosurgery in Havana, Cuba. So I will try to reach one of those 2 institutions to know more about that. And basically, the name Helsinki Committee is quite weird. I would say so it's, not definitive concerns, but there are, yes, some concerns. Although that you won't reach a judgment on serious concern just about that, but it's just like one little thing that you should keep in mind about this study. Now, are there concerns relating to the timing of or absence of study registration? So this is pretty easy to look. You look at the study. So the study, as I told you just before, has a clinicaltrial.gov identification number. So you can check this number, you can pick it, you can look at the study on clinicaltrial.gov, and then you can try to find the key dates that are reported on clinicaltrial.gov. So you can see that the first inclusion was on 2017, and then the registration was also on 2017. But if you look at the months, the first inclusion was done on July, the last inclusion on October, the last visit of the last patient 1 month after, because it was a 1-month follow-up, so it's pretty expected, in November the same year. and the registration was done in December. So basically, we have a retrospective registration. Retrospective registration is not such a good practice, so it should be prospective registration. So actually, registration should be before the first inclusion and not after the last visit of the last patient. Still, registration was, of course, before publication, as it is mentioned in the publication. And basically, the publication was very fast after the first inclusion, because in, I would say, less than 1 year, you have the first inclusion of the patient and the publication, which, in my experience, is pretty rare to be so fast in publishing a clinical trial, but still, it's possible. Again, we have this problem with retrospective registration. And this, you can easily find all those dates on clinicaltrial.gov. So basically, you can see that the study start was on 2017 July, and then the first submission of the registration was on 27 December. So you can see here, you know, the issue of retrospective registration. So basically, I would say this is a big warning, even bigger than the first one. Perhaps not sufficient to invalidate all the study, but still, you still have to rate it. It's a yes, and this will lead you to have some concerns for the study. So some concerns plus some concerns plus some concerns, at what point it can make a serious concern. So are there important inconsistencies between the publication and the registration documents? Yes, no, unclear, not applicable. So you can have a look, basically, and you can see that it's very interesting and a good practices, actually, because they posted the results in clinicaltrial.gov. So this is nice because you can look at the results on clinicaltrial.gov, and you can compare the result on clinicaltrial.gov with the results of the study. So it might make you, it makes it possible for you to check for inconsistencies. And you can see a few inconsistencies in this study. If you look at, for instance, African patients, you have 8 African patients here and 13 here. If you look at, I would say, African patients, you can say 8 in the 21 group and 12 in this group. So 8 and 13, 8 and 12, which is a bit different. If you look at other categories, you will see that the match is not perfect. So it might be something you want to take into consideration. So basically, yes, we have some kind of, you know, discrepancies between the registry, and you have some discrepancies on other results. For instance, on this ABC irritability subscale, which is the main endpoint of the study, on the baseline measurement, you can see that, okay, the mean are the same between the paper and clinicaltrial.gov, but the standard deviations are not the same. Here you can see the mean is the same, standard deviation are not the same. So there are some kind of, you know, inconsistency. Again, doesn't mean that there is a major issue, but it means that there are some inconsistencies here. Again, if you look at change in the ABC irritability subscale, so again, on the primary outcome of the study, on the registry, you have a difference of 0.47, and in the paper, you have 0.42. And they also provide an adjusted mean difference, which is 0.34, not exactly the same numerical value, and it cannot be just explained by rounding. So there is, again, an inconsistency between the results of the paper and the result appearing on clinicaltrial.gov. So those are the kind of stuff you should inspect. All things that are repeated in the paper and in the registry to see if both match. So we have another inconsistency. And by the way, we will see this later, but the difference in the placebo group of 0.37. So this is a pre-post difference between baseline and 4 weeks. It's very small for something that is assessed on a scale in which you would expect some regression to the mean. And perhaps in this disease, you should expect non-specific effects that would help to decrease the score more than, no difference at all because 0 is very low. And also you can see here a very low standard deviation, meaning that there is very few variability. So like it does not change for most participants and with very, very few variability across participants. But this is not the topic of this check. It will a thing that we will see later. So this check is basically to compare this number with these numbers, and basically those are not the same. So we can say that there is here like an inconsistency. By the way, if you look at change, it's perhaps a little bit less inconsistent. We have here the same number. Here, there is perhaps a rounding issue, but still the number is perhaps good. So in another place, we have less inconsistency. But still, this is a new thing where you have, yes, to answer the question, there are important inconsistency between the publication and the registration document. But of course, it does not make on its own a serious concern. So basically, the sum of all this stuff will bring you to a judgment about serious concern. Then is the recruitment of participants possible? This is something pretty difficult to judge. It involves sometimes some field expertise, and we will try to look at that. But in this study, it was very interesting because contact location in clinicaltrial.gov was, in Israel, while the region of enrollment was in Cuba. So it's pretty rare that the sponsor of a study is in a country very different from the country where the study is done when it is a monocentric trial. So when, of course, for multicentric and international trial, the sponsor has to be in a country that is not exactly the same as the center, but for a monocentric trial, usually it is in the same country. So here for the recruitment, it's something like a little bit strange. But if you look at the PubPeer comment, you will see that author tried to give an explanation for that. But basically, as you can see in the clinicaltrial.gov numbers, all participants in both groups, so this is a 40 participant study, so 21 participants in one group and 19 in the second group, all come from Cuba. But the contact location is in Nazareth. This is also what is said in the paper. In the paper, it said that the participants were recruited from the investigators' normal pool of patients who voluntarily came in to seek treatment for the symptoms of autism spectrum disorder. They responded also to flyers of recruitment and print ads. So we can see that it's basically a monocentric trial. If you look at the authors, we have one author, which is the primary author, which is in Israel. And you have also all authors that are located in Cuba. This author, Gary Leisman, has also an affiliation in Cuba. Okay. So it can explain why he registered it from Israel, because he has two affiliations. So basically, it's difficult to make a judgment of major concern for that. But still, it's a monocentric study conducted in Cuba. So we have the Center of Institute for Neurology and Neurosurgery in Cuba, Havana. We can try to look again at the study timeline, and you can see that between the first inclusion of the first patient and the last inclusion, we have 3 months. So 3 months to recruit 40 participants in one center can be quite fast. So this is the kind of stuff you will have to judge if you want to use InspectSR. And usually in trials that are problematic, you have very, very inconsistent delays between the first inclusion and the last inclusion, and things that are quite inconsistent with what could be expected. So for this study, we could maybe expect a slower recruitment, although it's still possible if they are highly motivated, of course, to recruit at this pace. The last visit of the last patient is 1 month after the last inclusion, which is perfectly fine. And we had 4 recruitment months for 40 participants in one center by, I would say, 4 investigators. Yes, can be challenging, especially if you add the, the number of visits. So still, you can say, yes, the recruitment is pretty implausible for various reasons because of location, but also because of the space that is a little bit, high, but still I cannot make my own full judgment of serious concerns based on that. I have just like some ideas that the study is a little bit strange, weird, thing like that. Okay, and are the reported methods implausible considering the reported resources? It's frequent that in this kind of trials that are beyond repair, they claim that they have recruited a lot of participants, but they declare that there was no funding for the study. And we all know that conducting a randomized control trial is very expensive because it's demanding, for instance, to have the time to see the participants, to monitor the data carefully, pay for the drugs under study, to pay for the control. So for instance, in this study, you have to have the device, which is a laser, but you have also to have the placebo. Basically, you have to make your own judgment about, do you think this study was costly, and will this be compatible with what is disclosed by the authors? So you can again look at this paragraph in the paper. So it said that it was found by Erconia Corp, so the producer of the laser. Okay, so they have some kind of funding. They don't declare, of course, the amount, but this is something you regularly don't have in a clinical trial. They had some assistance with statistical analysis and research methodology. So now let's look at how much demanding was the study in terms of clinical activity. So still we have this 1 month between the different visits. And then we say that we have 3 investigators at Cuba, maybe 4 because of the primary investigator who is both in Israel and Cuba. We have 4 recruitment months. 4 recruitment months is like, we saw it already quite fast to recruit as much as 40 participants in 4 months. Then we have 2 treatment sessions per week, plus 4 visits. And then we have 1 scale ABC that should be done in 50 minutes, and a CGI scale that is done in 1-2 minutes. So pretty easy to do, not very demanding. Still, we have a lot of visits, so it needs time and resources to perform the study. So we don't know that much about, their organization, but it takes time. For the ABC, it's not very clear in the paper because sometimes you can give it to the parents of the children with autism, or you can also have an external assessor, meaning that it takes more time if the assessor is external. So this is pretty unclear. But still, it takes time. It takes time to see 4 times plus 2 treatment sessions per week for the treatment. So it takes time, but we don't have sufficient details on, the resources to be sure that there is like a reason to concern. So it could be rather unclear for this one, but I'm not sure we can rate this one pretty accurately and decide whether the methods were implausible concerning the reported resource. But still, I think for this one, we might have some concerns. So not definitive, but still some concerns. But as I told you, we have already like some big concerns that arose from before. So the overall study's judgment is unchanged. It's still serious concerns. And now we will go a little bit deeper in inspecting the paper. So by inspecting the text and the figure. So the first one, when you inspect text and figure, is to inspect the text for plagiarism, so duplicated content. So for instance, tables that are the same from another paper, or text that is the same for another paper. And this is often pretty difficult to assess. So in this assessment today, I've just assessed the manuscript for plagiarism. So I use it, I put it in my own university plagiarism checker. And then I found that there was no clear evidence of plagiarism for this paper. Okay, plagiarism, checkers are not perfect, but still I found no problem, so it passes the test. Is there evidence of manipulation or duplication of figures? So now for this one, you will have to inspect with more details the different figures of the paper. So here are the figures of the paper. So basically we have various figures reporting the results on the ABC scale. And here we have another figure. So let's have a look at this figure. Maybe we don't see that one figure is a duplication of another one. If you look the figure 2 by 2, basically, I would say that it passes this test. When I assessed the trial, I found no reason to consider that one figure was a duplication of the other one. You know that in some fields like biological research, you can sometimes have duplicates figures from one part to the other. It could be Western blots. It can be also figure of histology that have some patterns that are exactly the same from one to another figure where there should not be exactly the same. So basically, we found nothing about that. And if you look at the figure, of course, they are not perfect. Of course, we will see later that there are problems in these figures, but we don't have problems that are related with manipulation. So we don't have problems like figures that have been changed or edited, like for instance with PowerPoint, for instance to add error bars, things like that. So figures seems to be genuine. So this is a check that was passed. So actually, for this overall domain, I think that I found no possible concerns or no concern. And maybe some people will disagree with me, but at least I find no concern. So it passed this checking phase. So now we are going to inspect the results in the study. And we are going to see if we have some concerns about the full results of the study. So here you can see we have much more checks to apply. Of course, inspecting results in randomized controlled trial will be super useful to check for several inconsistencies and patterns associated with, problematic data. So are there unexplained discrepancies between reported data and participant eligibility criteria? So this is something you can look in the study. So for instance, they say in the eligibility criteria that they will recruit males or females, and you can see that they recruited males or female, which is like a first way to check for an inconsistency. So there is no inconsistency here, so it's okay. But you can have some study where they say we recruited males, and in the results you have males and females. So this will be a kind of discrepancy between the results and the selection criteria. You can also check many other stuff. So we will check. So the age, let's say people who are aged between 5 and 17 years. And then we can check the mean was 8.2, 8.4. The standard deviation was 3, 3.2. And the range was 5 to 16 and 5 to 16, which is, of course, compatible with the selection criteria. So here again, I have no problem with that, and I find no inconsistency between the selection criteria and the various results for age and for gender. Now you can look that they say that the participants' aberrant behavior checklist ABC irritability subscore was above 18. So we can look at the baseline score, and we can look that the baseline score was 23.1 plus 9.3 in one group, and 24.7 plus 5.1 in the second group. So now it's very difficult because you should have the individual patient data to look at that. And based on the aggregated data, it's very difficult. But you can see that the standard deviation here is big. If the distribution was normal, actually, in mean plus minus 2 standard deviation, you should have 95% of the observation. So if the distribution was normal, actually, you should have 95% of observation between, I would say, nearly 3 and 43, which is a little bit concerning because they should have been recruited with a score up to 18. So you should have expected distribution very weird with very high values for that to be compatible with that. So I don't have the definite proof that there is a problem. So I will keep in mind that there is, yes, a potential issue, but not something that will qualify for serious concern, but something that will qualify for some concerns. Then you can check here on the ABC irritability subscale, and you can see another value that is not exactly the same, by the way, which is something we will see. But with this value, maybe it's more compatible with that. But now we have another problem because we have here one value for this irritability subscale that is not the same as the value we have in this table. And basically the baseline value for irritability subscale is the baseline value for global score in this scale. But this is not the purpose of this check. This will be the purpose of another check. This is exactly what I wanted to show, that the two are not the same, but still, this is not this check, this is another check. Here we just want to see if there are some inconsistencies between the selection criteria and the tables and the results of the study. Then they say that people should have a CGI score up to 4, and you can see the CGI score. All were up to 4, so this is not an inconsistency. It's pretty okay. So we are good on this check for this selection criteria. And then they say that they abstain for undertaking new treatment during the study time. And they say that they should not be included in case of any other disorder, including neurological, including use of the psychotropic drug and use in participation in research. So if we follow these selection criteria, people should not have a psychotropic drugs when included in the study, and they should not change their psychotropic drugs. So basically, they should have no new treatment during the study time, so no psychotropic drugs. And here they provide the table with psychotropic drugs, and you can see that we have a lot of people with some kind of psychotropic drugs. So I would say that it's rather unclear. Maybe they mean that they don't need to have another psychotropic drugs for something different than autism, but it's not clear. So I would say again, this is a reason to have some kind of concern in the study. So basically, for this first check, there are unexplained discrepancies between reported data and patient eligibility criteria. So it's a yes, and I put the color orange again to say that I have some concerns. Now, are the number of participants allocated to each group implausible given the allocation method? So this is a new question. This is a randomized control trial, and we want to see, for instance, if they say that the randomization was supposed to be balanced across group, if actually the actual number are coherent with that. They say that they have 40 participants, 21 in one group, 19 in the second group. We don't have a lot of details about randomization in this study, so we don't know how it was done, but still 21 and 19, it's compatible with a one by one balanced randomization, and this is still plausible. So I would say it passes this test. Now, next check to do. Are any baseline data implausible? So it's yes, no, unclear, not applicable, as always. So we can check. We saw male and female. It was like, you know, I would say more males than females, but this is what is expected in autism spectrum disorder. So this is a check that basically you will have to bring in some knowledge about the disease. So you should look whether there is like some things that are not expected in this disease, that are very unusual, things that are very, strange. So basically here there is nothing strange. And then we can look at the age. We found nothing very strange in the age. You have the gender. We already saw the gender. Here we have something a little bit weird, but of course it's not about, you know, baseline data. We already saw that in theory, the inclusion criteria, you should not have so many psychotropic drugs. But I just want also to mention that in this table, there is something very strange, because one line is risperidone, which is actually the commercial name for risperidone. So basically, there is some kind of strange results, but this is not part of this check. We saw also the scores. The scores might be, you know, compatible with what is expected, but still there is a little difference. We saw it, and we will see it later. This is not the purpose of the check. And for CGI baseline, basically, we saw that it was coherent with the inclusion criteria. So we don't have, you know, big concerns about baseline data. They seem all to be plausible. There is something that is fully implausible or fully crazy. So it passes the check. Now, are there any discrepancies between results reported in figures, tables, and text? So this is now a very relevant test for this study, because I already told you that we found some kind of inconsistencies between figures, table, and text. So we will look at that. Oh, this is pretty clear that there is a lot of red in this slide. So for instance, here you compare the numbers between the text and the table, and you try to see if there are some things that are totally inconsistent, things that are totally, you know, not plausible. So as I told you, actually, in table 7 and in table 11, we had here in table 7 the global score, which is at baseline 30.5 with a SD of 6.7 and 29.6 with a standard deviation of 6.8 for the global score. But they provide exactly the same scale at baseline in another table. And when you look at this scale, this is a subscore, which is the primary outcome, the irritability subscore. You can see that the number here is exactly the same as the global score, which is obviously not possible. They have another table, table 21. If you look at this paper in detail, you will see that it's very strange because they have so many tables. But basically, within the tables, you can check for some kind of inconsistencies. And it appears pretty clear that in this table, irritability is exactly the same as irritability in this table as baseline, we have exactly the same numbers. So basically, here there is no inconsistency, it's consistent. But you have still the inconsistency between this table and this table. And you can see also that there are many other inconsistencies. For instance, here, the global scores become irritability. Here, irritability and agitation become lethargy and social withdrawal. Here, stereotypic behavior becomes this one, and here this one. So it seems pretty clear that in this study, they have just made a mistake in the table by inverting inappropriate speech and global score. So basically, if you do that, I think there is some kind of, mess in the table and mess in the headers of the lines. So basically, we have what we can call an inconsistency, but this might be explained by problems when formatting basically table set of 7, which is obviously something that is still, possible to make mistakes. It's always possible to make mistakes, but this adds to all the other mistakes we have seen just before. Here in another table, I think there was no big issue. For instance, here I was able to take these values and to compute, the difference between both. And the difference between both, you can compute it by yourself. It's pretty okay. It's compatible with that. So we are pretty okay. So I would say 30.5 minus 29.6, you have about 1 point difference. 0.995, it's okay. It's compliant. Here you can do the same. 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 So inconsistencies are not everywhere. And by the way, this is a table where the results where global score should be here. So here is a table where you should expect a problem of inverting the name on the lines, but the problem is exactly the same here. So you have exactly the same problem because those two tables are consistent across the two, but not consistent with the rest. Okay, for positive responders, we can check between table 30 and 40. You can see that we have here 17, here 0, 17, 0. So we have exactly the same numbers. There is no inconsistency. So basically, when you are trying to apply this check, you are tracking in the paper whether you have inconsistent results across tables and between tables and also text. I show here a test based on the tables, but because we had a lot of tables, but of course you can also check between tables and text. But still, I think we have some kind of inconsistencies and discrepancies in this, and I think it starts to be like serious. So I put it red for me, but basically the answer is yes, we have problems. Are there a number of participants left to follow up implausible? You know that in clinical trials, you usually have always some problems with follow-up. It's not so easy to run a clinical trial, and you usually have patient loss of follow-up. So we can look at this trial, and what they say that all participants in the study completed all study visits and all procedures, and all patients had all study measurements recorded through the study endpoint evaluations. So they even say that it was not necessary to impute data with the least observation carried forward method. So basically, here we have a study with no missing data, no patient lost to follow-up. Of course, it's a small study, in a monocentric study, in a population of autistic patients that you might expect that they might come back to the hospital. But still, no missing data at all. It's little bit strange in a clinical trial, and we are not used to that. So I would say there are some, yes, concerns here too. Are there any unexplained inconsistency in the number of participants? This is a newer check. So basically, we will see that if the number of participants is always 21 and 18 and 19 in the study, because, of course, there is no missing data at all. So we should have at every place, the same number of participants. So we can have a look, and basically I had a look. You can have a look at the text, and it passes. It passes the test. There is no differences between tables, between text. It's always 19, it's always 21 in the both groups, and always, of course, 40 for the total of participants. Next test. Are any outcome data, including estimated treatment effect, implausible? So now you will have to look a little bit at the data. So the main outcome was ABC irritability subscale. It was a change from baseline to endpoints. And we will look at this, data. So first of all, we can, compute the difference. So basically, I'm sorry, but my slide is not good because what I've compared is the change, the outcome, as you can see here, 14.8 and 0.3. So I compared the main outcome. So my yellow part is not nice, but if you compare the results, so basically the change here and the change here, and I put it in R to perform like to combine it in, an effect size, a standard mean deviation. Actually, I find a standard mean deviation of -3, which is very, very huge for a randomized controlled trial against placebo. So just to give you an order of magnitude, most medical interventions have effect size about between, I would say, 0.2 and 1. And it's very rare to have an effect size of this magnitude. So 3 is very exceptional. It can be seen, of course, in small trials, and this one is a small trial, but still, it's a very, very big effect size. So it seems like it's very strange. Moreover, if you remember, I told you that one very weird aspect of this study was that in the placebo laser group, you had almost no change. So basically, in the this is the same in the paper. You can see that in the intervention group, they have 14.8 points difference from the pre-treatment and post-treatment. And at the end, in the placebo group, they have 0.3 difference between pre and post. So basically, we have almost no change from, here, baseline to endpoints. So almost no change. In a study where you would expect also, some kind of, I would say, regression to the mean, non-specific effects, so you will expect more change. So basically, we have a very big effect size, and this very big effect size is mostly related with no effect in the placebo group. So it means that if you want to go further in inspecting this study, you will have to focus a lot on the placebo group to understand better what's going on, because it's not expected to have so few difference pre-post, but also so few variability. You know that this is very, 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 very small. And basically, it's pretty also inconsistent because you can derive pre-post standard deviation by using the pre-standard deviation, the post-standard deviation, and a correlation coefficient. So if we believe that the correlation between pre and post is pretty the same in the placebo group and in the, test group, which is the laser group. If you believe that correlation pre and post should be pretty the same, which is not a big hypothesis, then you should have a higher also variability here, but almost no variability. So here, there is some kind of flag that you will need to inspect further to get a better opinion of this study. And actually, you can inspect this in table 15. And if you look at table 15, they provide the baseline score, the endpoint score, and the change score for the global score, which is actually the good one here in comparison with what we saw previously, and all the different subscales of the scale. And you can see again here that we have a problem of excess of homogeneity in the placebo group with almost no change in the number here. Here again, no change in the number. So basically exactly the same pre-score, exactly the same post-score, the same, pre-score and post-score, pre-score and post-score, and exactly the same SD pre and post for both, value of the subscale. Here again, very few variability. Here again, very few variability. So we have some kind of what we call an excess of homogeneity, because even under the new hypothesis that there is no change in the placebo group, you should expect more intra-individual variation of focus, and you should expect also some error of measurement with this kind of scale, because this is a scale that should be very variable from one time to the other. It's an heteroevaluation, so it's not expected that there is no variability at all. But this is exactly the kind of thing that is a red flag. Again, if we look at the figure, I don't know if you saw it before, but you can see that in the figure, in the placebo group, there is almost no difference between each time point. No difference. So basically what we saw here in this table is pretty consistent with the figure and also with the placebo group, that there is almost no difference in the percentage. Here it's percentage of people who respond. No difference, flat line. So it's very hard to see a flat line for placebo. So as we say just before, on this figure, there is no things that say that the figures are manipulated, but still, these are very implausible data that I put in red. And you should then inspect the individual patient data. The principal author shared the individual patient data of the trial. And you can have here a table that is the table provided by the author. This is the table in the test group. As you can see, there is no missing data, which is very consistent with what is written in the text. But as you can see, we have also different data from one time point to the other, always decreasing, of course, but still we have some different results. But as we saw just before in the table, it's much more interesting to inspect the data that are coming from the placebo arm. And here are the data, I would say, from the, the test group. And just this one was very, repeated, but it's just one among all the patients in this group. Now I will give you a taste of what is in the placebo group. And as you can see, in the placebo group, this is not the same story. As you can see in red, we have patients with the same value at baseline, week 2, week 4, week 8. Same value at baseline, week 2. A difference here between week 4, week 8. Here again, same value. 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 Now I think I repeated me too much. So here, just a small difference, but then the same value, same value, same value, same value again. So this is very, very, very strange. You should not expect this pattern because of various biases that are expected in trials, like regression to the mean, stuff like that, but also because of intra-individual variability, measurement error. That will mean that at each visit, you should have much more variability for a given individual. So I would say that now for this one, we have a very big red flag. Now, next check. Are the means and variance of integer data implausible? So for that, you will have to inspect a bit the figure, but you will need to have a tool. So first of all, you will need to find within these tables, all the tables with numbers, which are the tables that provide you integers. So I have selected 2 tables here that have integers because global score are integer variables. So basically, when you rate the score, you rate 1, 2, 3, 4, 5 points, but there is no values with comma. So if there is no decimal, so it's an integer, so you can try to see this. And the test that we will apply is green test. Green test is pretty easy to apply. You have, here I put it, here you have a direct link to the green test for Inspect SR. It's a test that has been developed to see if when you put the mean that is observed in the table, so for instance, the mean here was 30.5, so I put the mean here. You put the sample size, and you look actually whether this rounding 0.5 is compatible with the 21 sample size. So you are basically checking whether the roundings are plausible given the number of subjects observed and given the fact that you have a variable that is an integer. So basically, I've done all the checks using the Inspect SR checks, and I found no problem for those 2 dimensions. So no problem for that. So basically, it's a green, it passes the test. So you can use green test, and you can know more also by looking at Jack Wilkinson video. You can find this test online. Now, next step. Are there errors in statistical results? So basically, here you have to inspect a little bit more the statistical results of the study. This is pretty easy in this case because they provide the t, they provide the degree of freedom, and they provide the p-value. So you can easily write R script. So I put the R script, and if you are interested, I can share it with you. But I made my own R script to test all those aspects. And basically, for global score, I put the global score minus 1.25. I put the degrees of freedom 18, and I was able to find the p-value, which is okay. The p-value was 0.227, and actually it was exactly the same that is here. So it passed the test. So actually I made all those tests, and for all these, it passed the test, all the green ones. For this one, I put the value here, I think here, and the value 38. And actually, it's okay, it works. It's below 0.0005, but strangely, it's also below 0.0001. So it's pretty weird that in a way they use it here, 0.0001, and here they use it as 0.005. So this one is a little bit strange, okay, but it's not a big issue because it's always true. And this one, in appropriate speech, I put it here. I computed the p-value, and actually the p-value was a little bit above 0.0001, but okay, we can say that it's a minor issue, but still something a little bit weird, but not the big finding as the one we found just before. For hyperactivity and compliance, so in another table, you can do exactly the same. And I found exactly the same problem with hyperactivity and non-compliance. So basically, the number are, not exactly the same for the t-test here. Okay. This is in the second group because this one was overall, and I think that this one was, in pre-post differences, but still, I have exactly the same way, 0.005, 0.01, with exactly the same thing, because here it was also below 0.001, and here it was also still a little bit, above the value. So again, a little inconsistency, but minor, that was here. For this one, it was like the table where they computed the Fisher test. I was exactly able to compute the Fisher test p-value, which was very, consistent with this. So no problem for that. So basically, are there errors in statistical results? I put it a no. I think it passes the test, even if I have some little concerns that things are not really perfect with the study. Then, and are there any contradiction implied by the data? So actually, I put nothing because I think I found no other big contradiction, except perhaps the fact that, the idea of a placebo laser is a little bit weird. I know what is a laser, I know what is a placebo. A placebo laser, it's like something not expected, but still, I don't know. I will need to learn more about that. So I don't know. So I think it passes the test, and I found nothing more to say. And then the last test does not always apply. So sometimes it's not applicable. It says, if there is a second publication of the same trial, are there discrepancies between two publications? So you are checking basically here no longer only the internal coherence and consistency of the study, you are checking for inconsistency between the published trial and any other secondary publication of the trial. And if you are trying to look at that, this is interesting because for this study, there was a secondary publication. So one first challenge is to find it because it's not, in a very famous journal and so on. So it's not so easy to find it. It's a secondary publication that does not involve the primary author. You have, however, all the other Cuban author and one other more. And you can try to look a bit at this study. I look at this study. So basically, what they say in the secondary publication is that they have 15 males and five females in the test group. So basically, they say that they have 21 patients in the active group, which is okay. And basically, they say that 19% in the placebo group, which is okay. So I mean, I put the wrong color here, but basically you can see that this is coherent. They have the same number of participants in the test group and the same number of participants in the placebo group. So there is no inconsistency between the primary publication and the secondary publication for this variable. So sorry for the color, it should be a green. But then if you look at other things, we can see in the secondary publication here, you have the ABC irritability score at baseline at endpoints. You can see that for the test group, it's exactly the same values. Basically, it's the same value. At endpoint, it's also basically the same value. If you look at this one and this one, it's the same. If you look at the placebo group, here you have the same value. But here, you have the same mean, but you don't have the same standard deviation. So there is some sort of inconsistency between the secondary publication and the primary publication, despite they clearly state that this was exactly the same number of participants. And if you remember, we have no missing data. Another kind of differences can be found here in the global score. So the global score is 107.29. So of course, you remember this table, there is a problem in the table, but we can find this value here and with the good standard deviation. But if you look in the placebo group, again, the numbers of the total score are not the same for the number and for the standard deviation. Here for irritability, which is the primary outcome, you can find also some kind of little discrepancies between the secondary publication and the primary publication. So basically, we have again some concerns here. So we can now be quite sure that we have some serious concern for this study, especially because you know of the excess of homogeneity we can see in the study and some kind of very, very inconsistent and strange results. But the excess of homogeneity, and especially after inspecting the individual patient data, reinforce the concerns you have. So basically, those concerns that we have explored in these 3 dimensions were already reflected in the peer comments, but I think that there are serious concerns for this study. And based on the Inspect SR evaluation, this study cannot be included in a systematic review because you cannot trust its results. Inspect SR is not a tool that will be a diagnosis for you. You cannot be 100% sure that there is a problem, but it's a tool just to give you some ideas of whether there could be a problem with the study and whether it is really, really needed to include it in a systematic review and meta-analysis. So thank you so much.